Hi, my name is Florence Milliken, and I'm one of the professional liaison consultants for the Health and Care Professions Council. In this video, I'll be giving you an overview of the changes in the HCPC's updated standards of proficiency on the theme of registrants' mental health. Firstly, a quick recap about the updated standards of proficiency. The HCPC standards of proficiency have been revised and the updates come into effect on the 1st of September 2023. The standards of proficiency are the professional standards all HCPC registrants must meet. In the updated standards, some changes apply to all of the 15 professions we regulate, while others only apply to specific professions. The changes have been made to enhance the current standards and reflect the reality of practicing in today's healthcare landscape. The key changes can be grouped into 5 themes: equality, diversity and inclusion, further centralising the service user, registrants' mental health, digital skills and new technologies, and leadership. Across all the changes, the wording that they use has moved away from a passive understanding of the standards and towards an active implementation of them. So what has changed on the theme of registrants' mental health? The HCPC's previous standards of proficiency say that registrants must understand the importance of maintaining their own health as a part of maintaining their fitness to practice. The updated standards say, firstly, that registrants must understand the importance of their own mental and physical health and well-being strategies in maintaining fitness to practice. And secondly, that registrants must develop and adopt clear strategies for physical and mental self-care and self-awareness to maintain a high standard of professional effectiveness and a safe working environment. These are both updates to Standard 3. So what does this mean for registrants? Well, if a registrant's physical or mental health impacts their ability to practice safely and effectively, then they should not practice. As a key part of this, registrants should be proactively managing their mental health. The changes aim to recognise the emotional burden of practicing in today's healthcare landscape and empower HCPC registrants to assess, manage and protect their own health. It is the responsibility of employers to provide working environments in which HCPC registrants can do this. So does this mean a registrant needs to stop practicing if they develop a health condition? Well, that depends on how the condition affects their fitness to practice and what can be done to ensure they can practice safely and effectively. If the condition can be managed, for example, through medication or treatment, then they can continue. Alternatively, if adaptations, limitations or changes to practice can be made or reasonable adjustments can be made in the workplace, then they can also continue. It is entirely possible to practice safely and effectively if you have a mental health episode or experience repeated episodes, or if you have an ongoing mental health condition. What do HCPC registrants actually need to do? Well, from the 1st of September onwards, all HCPC registrants will need to meet the updated standards as far as they relate to their scope of practice. There's no set way to meet the standard relating to mental health or to show you meet it, and actually most registrants will be already meeting it in their practice every day. However, we recommend that registrants focus some continuing professional development activities on filling any gaps in their practice before the 1st of September 2023. And the gap analysis tool on the HCPC website can be a good starting point for this. Our suggestions for meeting this standard include adding wellness goals into your personal assessments, using your own notes to make observations about your health, recording any use of mental health resources and support, and this can come from yourself, your employers, or from your colleagues. Recording any development of personal strategies to safeguard your health. In summary, we've looked at what has changed on the theme of registrants' mental health in our updated standards and ways in which you may choose to assess and safeguard your health. If you're a registrant, I would now invite you to look on our website for the details of the updated standards and the support available. And you can also download the gap analysis tool to develop your next steps.